Welcome to today's educational journey as we delve into the world of liver abscesses. A liver abscess is a pus-filled mass inside the liver. It's a serious condition that requires prompt diagnosis and treatment. We'll explore its causes, how it develops, who is at risk, and the best approaches to manage and prevent this disease. So, what causes a liver abscess? The most common culprits are bacterial infections, often stemming from infections elsewhere in the body. These bacteria can travel to the liver via the bloodstream, the biliary tract which carries bile, or through direct spread from nearby infected organs. Common bacteria involved include Klebsiella pneumonia, Escherichia coli E. coli, and Streptococcus species. Amoebic liver abscesses, caused by the parasite Entamoeba histolytica, are also prevalent, particularly in regions with poor sanitation. Rarely, fungal infections or trauma to the liver can lead to abscess formation. Let's understand how a liver abscess develops. First, an infection, be it bacterial, amoebic, or fungal, reaches the liver. The body's immune system responds by sending white blood cells to the site of infection. These cells attack the invading organisms, leading to inflammation and tissue damage. As the infection progresses, a cavity forms filled with dead cells, bacteria, and inflammatory debris. This is the abscess. The abscess can grow, putting pressure on surrounding liver tissue and potentially spreading the infection to other organs if left untreated. In amoebic abscesses, the parasite digests liver tissue, creating a large, single cavity. Now, who is at risk of developing a liver abscess? Certain factors increase susceptibility. Individuals with weakened immune systems, such as those with HVs, diabetes, or those undergoing chemotherapy, are more vulnerable. People with biliary tract diseases like gallstones or cholangitis bile duct inflammation are also at higher risk. Other risk factors include recent abdominal surgery or trauma, intravenous drug use, and travel to or residence in areas where amoebic infections are common, such as parts of Asia, Africa, and Latin America. What are the telltale signs of a liver abscess? The symptoms can vary depending on the cause and size of the abscess, but common indicators include fever, often accompanied by chills and sweats. Abdominal pain, typically in the right upper quadrant, is another frequent symptom. Patients may also experience nausea, vomiting, loss of appetite, and weight loss. Jaundice, or yellowing of the skin and eyes, can occur if the abscess obstructs the bile ducts. In some cases, there may be referred pain to the right shoulder. How is a liver abscess diagnosed? The process usually begins with a physical examination and a review of the patient's medical history. Blood tests are crucial to check for signs of infection, such as elevated white blood cell count, and to assess liver function. Imaging studies are essential for confirming the diagnosis. Ultrasound is often used as the initial imaging modality, but CT scans and MRI provide more detailed views of the liver and can help determine the size, location, and number of abscesses. Finally, aspiration of the abscess fluid, a procedure where a needle is used to draw out fluid from the abscess, is performed to identify the causative organism and guide appropriate treatment. Liver abscesses can be classified based on their cause. The two primary types are pyogenic liver abscesses, which are caused by bacteria, and amoebic liver abscesses, caused by the parasite Entamoeba histolytica. Less common are fungal liver abscesses. The classification helps in determining the specific treatment strategy. Treatment for a liver abscess typically involves a combination of antibiotics or antiparasitic medications and drainage of the abscess. For bacterial abscesses, broad-spectrum antibiotics are administered initially, followed by targeted antibiotics once the causative organism is identified. Amoebic abscesses are treated with antiparasitic drugs like metronidazole. Drainage can be performed percutaneously, meaning through the skin using a needle guided by imaging, or surgically. Percutaneous drainage is often the preferred method for single, large abscesses. Surgery may be necessary for multiple abscesses or if percutaneous drainage is unsuccessful. Supportive care, including pain management and nutritional support, is also crucial. Preventing liver abscesses involves addressing the underlying risk factors. Good hygiene practices, including thorough hand washing, are essential to prevent the spread of infections. Safe food and water consumption, especially when traveling to regions with poor sanitation, can prevent amoebic infections. Prompt treatment of infections elsewhere in the body can prevent them from spreading to the liver. For individuals with biliary tract diseases, managing those conditions effectively can reduce the risk of abscess formation. The prognosis for liver abscesses depends on several factors, including the underlying cause, the size and location of the abscess, the patient's overall health, and the timeliness of diagnosis and treatment. With prompt and appropriate treatment, most patients recover fully. However, complications can occur, such as sepsis, a bloodstream infection, rupture of the abscess leading to peritonitis, inflammation of the abdominal lining, or spread of the infection to other organs. Recent research focuses on improving diagnostic techniques, such as using advanced imaging modalities and molecular diagnostics to identify causative organisms more rapidly. Studies are also exploring the effectiveness of different antibiotic regimens and drainage techniques to optimize treatment outcomes.